We all desire a lifestyle rich in activities that we enjoy. Our quality of life is directly related to good vision, something most people take for granted until something happens to their eyesight. Cataracts cause blurred vision and can severely hinder our enjoyment of life. Luckily today, there is a solution: lens replacement at Dallas Eye Care. A normal eye has a lens, much like a camera. Light passes through the clear lens to the retina in the back of the eye. The lens focuses this light onto the retina, where the image is changed into nerve signals that are sent to the brain. A cataract occurs when a lens becomes cloudy, reducing the amount of light that reaches the retina. Light is scattered at the back of the eye, which results in a dull or blurred vision. When a cataract is small, the cloudiness affects only a small part of the lens. Cataracts tend to grow slowly, so vision gets worse gradually. Over time, seeing may become more difficult.
The lights on the cars were yellow, and I knew they weren't supposed to be yellow. The lights were just so extremely bright. It made you hard to see and hard to judge distances. So I just stopped driving at night.
There are many common symptoms of cataracts: fading or yellowing of colors, glare or light sensitivity, poor night vision, double vision in the eye, and needing brighter light to read.
I had to strain to read, and without glasses everything looked milky, and I just couldn't read more than 10 or 15 minutes. And I love to do crossword puzzles, and that was a strain. So it really was taking away from things that I really enjoy doing.
Cataract development is a normal process of aging and is a common cause of decreased vision, particularly for the elderly. Cataracts can also develop from eye injuries, medical problems like diabetes, and prolonged exposure to ultraviolet sunlight. Cataracts are treatable. The best way to treat a cataract is to remove the old clouded lens and replace it with a new one. It's a simple operating procedure called phacoemulsification, or phaco. No stitches or sutures are required. The surgeon inserts an ultrasonic probe through a tiny incision. The probe dissolves the cloudy lens and vacuums these tiny pieces out of the eye. An artificial lens called an intraocular lens will replace the clouded lens. It consists of a round lens called the optic and the haptics or arms that help keep the lens centered and secure in the eye. The next step is to implant the intraocular lens in the eye to replace the cloudy lens. The new lens is designed to conform to the natural shape of the eye and will be permanent, lasting a lifetime.
Should you qualify, your surgeon may offer you the latest in state-of-the-art lens technology, including premium implants that may help eliminate the need for glasses or contact lenses.
See if we can get you seeing any better here.
At Dallas Eye Care, our ophthalmologists provide a thorough eye examination and can tell you whether cataract or some other problem is the cause of your vision loss.
From the testing that I see, that your eye doesn't see well in the face of bright light. You have some glare disability.
If a cataract is detected, surgery should be considered when there is enough loss of vision to interfere with your daily activities. Based on your symptoms, you and your ophthalmologist should decide together when surgery is appropriate for you.
Just hold real still for me. That's lovely.
Your ophthalmologist will schedule additional tests for you. These tests will accurately measure the length of your eye to calculate the power of your new implanted lens. If you have an astigmatism, you can discuss with your ophthalmologist incorporating additional refractive surgery with your cataract surgery. With this procedure, the surgeon can reduce your need for glasses and give you the best possible vision after surgery. Cataract surgeries are performed at Walnut Hill Surgery Center, located on the 3rd floor.
Hello, is this Miss Thompson? Miss Thompson, hi, this is Donna from Dallas Eye Care.
A staff member from the surgery center will call you a few days before to confirm your surgery appointment, review the pre-surgery instructions with you, and answer any questions. In preparation for your surgery, you will receive a prescription for eye drops.
3 days before surgery, you will begin applying all eye drops to the eyes scheduled for surgery, as prescribed by your surgeon.
It is very important that you separate the application of these different eye drops by at least 5 minutes. If you apply the eye drops at the same time, the first eye drop will be washed away by the application of the second. So remember, wait 5 minutes in between applying each eye drop. On the day of surgery, wear comfortable, loose-fitting clothing. A short-sleeve shirt with buttons up the front is recommended. You may wear your dentures and hearing aids as well as your glasses, but do not wear any makeup the day of surgery. Take all your usual morning medications. Do not stop any medications, including aspirin, if that is normal for you.
You may drink water in order to take your medications, but do not eat anything the morning of surgery.
If you need to take food with a medication, wait until after surgery. We will have donuts and other snacks for you at that time. For diabetics, additional instructions will be provided. Cataract surgery is an outpatient procedure. For your safety and protection, you should have someone bring you to the surgery center and take you home afterwards. If you need transportation, Dallas Eye Care can provide a van to pick you up and take you home. Upon arrival, check in at the surgery center on the 3rd floor.
Good morning. How are you this morning? And which eye are we doing this morning?
The left eye.
The left eye, correct.
Each patient is usually at the surgery center 4 to 5 hours from the time they arrive until they depart for home. In the pre-op room, a nurse will prepare you for surgery.
They explained everything that they were doing before they did it, and it was just very comforting to know that they respected me enough to let me know everything they were doing.
And then when I put the drops in, close your eyes.
The eye is dilated, and a topical anesthetic in the form of eye drops will numb your eye.
They put drops in to numb your eye, and you know, it's just like putting eye drops in, and it just numbs it, and you feel no pain of any kind.
Okay, sir.
An IV is applied to the hand to administer a short-acting sedative to help relax you.
Would you like a blanket?
Yeah, I'm fine.
All right. I'll let you have a seat right here in the chair.
After the eye is fully dilated, a nurse will take you by wheelchair to one of 2 operating rooms.
As they put me on the table to do the surgery, the nurses, everyone, they were just very calming and very efficient in what they were doing.
Using pillows and blankets, you'll be made as comfortable as possible in the operating room.
Poster just for you.
Thank you.
They kept me warm. They treated me nicely in the operating room. They told me what they were doing every minute of the time.
I'll be your anesthesiologist and give you some medicine here, help you relax a little bit.
Okay.
The skin around your eye will be thoroughly cleansed, and sterile coverings will be placed around your head. The surgeon uses a microscope, microsurgery instruments, and other modern technology to perform this state-of-the-art surgery.
We're going to use ultrasound to dissolve the lens now. Let me have you look straight ahead. Okay.
An anesthesiologist is in the operating room to administer a short-acting sedative through the IV. You will remain awake and comfortable throughout the procedure.
You're not completely asleep because he wants you to be able to respond. If he asks you a question or wants you to look up or look down, look to the right, look to the left, you have to be aware.
Putting your implant lens in right now.
Okay.
And you may notice the light changing a little bit.
A probe using ultrasound removes the cataract, and the new intraocular lens is implanted to replace the cloudy lens. This new lens is permanent and should last a lifetime.
As the procedure went along, the doctor was explaining to me how the procedure was going, and it makes you feel good to know that everything is going okay.
This eye looks beautiful. Your implant's in good position. Your astigmatism's been fixed. Cataract's gone. Perfect. All right. You did beautifully.
It doesn't take long, 6 to 7 minutes. It might seem a little long when you're laying there, but it really is not. It's real quick.
Okay, we're going to put this little clear shield on your face. Okay.
No stitches or sutures are required.
After just a few minutes, the entire procedure is complete. A clear shield is placed over the eye and will be removed the same day during your post-operative exam.
Thank you.
Right after it, I could sit up and everything was bright right away. So I knew it was a success.
They're going to give you all your instructions.
Leaving the operating room, a nurse will assist you to the recovery room.
I walked out into the ante room, and they served me a cup of coffee and a donut, and it was lovely.
You're going to check your blood pressure and temperature,
Okay, all right.
A nurse will monitor your vital signs following surgery. Supportive family may join you in the recovery room.
Here's your coffee.
Thank you so much.
Food and drink are provided to make you as comfortable as possible.
There's your muffin.
Oh, thank you. That looks good.
1 to 2 hours following surgery, you will receive a post-surgical examination. A staff member will review post-surgery instructions with you and your family members.
How are you doing?
Doing fine, doctor. Doing fine.
How's the eye feel?
Feels good. Feels good.
The surgeon will examine your eye before releasing you to go home.
And look to the left.
When you leave the surgery center, you won't have any patches over the eye, and you'll be able to use the eye immediately. You can resume your normal activities and care for yourself without any help. You can garden, exercise, golf, read, watch TV. You don't have to stop anything. It is best to ask your doctor when you can begin driving.
You will continue to use your prescription eye drops.
These eye drops may sting for 1 to 2 minutes after use, but this is normal. Do not rub or wipe your eye for the next 2 weeks, and makeup should not be worn on the eye for 5 days. Over the next few days, you may experience some discomfort or fluctuations in your vision. This is normal, as the eye is still healing. Tylenol, aspirin, Advil, or other over-the-counter pain medications are usually adequate. If the eye becomes very painful, contact the doctor's office immediately.
Let's take a look at your eye here.
1 week following surgery, patients return to see the doctor for a follow-up examination.
The cornea looks fine. The anterior chamber looks fine.
Many times, a patient finds after the first eye surgery that there is a noticeable difference in vision between the eyes. The ophthalmologist may recommend surgery on the second eye. In most cases, surgeries can be performed 2 weeks apart.
I was even more anxious to get it done because I knew what the first eye, how improved it was, and so I was really anxious to get them both seeing the same way. You know, it's kind of hard in between the surgeries because you see well out of one eye and you don't the other, so your old glasses don't help a lot.
All right, how about this one?
2 weeks after eye surgery, the patient is fitted with a new glasses prescription. Some insurance plans pay for a portion of cost on glasses after cataract surgery. Dallas Eye Care can check your benefits.
You're going to look up into the mirror.
Each patient will return in 4 months for an eye examination and reevaluation of your eyeglass prescription.
Over time, some patients may experience a gradual blurring of their vision after cataract surgery from a capsular haze. The lens implant sits in a capsule behind the pupil. Within months or even years later, the back of this capsule can cloud over and interfere with vision. A procedure called YAG laser capsulotomy can clear the pupil of this cloudy capsule. This painless procedure is done right in the ophthalmologist's office, and patients resume their normal activities immediately. As with any surgical procedure, there are some risks. Although rare, serious complications can occur during or after cataract surgery, some severe enough to limit vision. These complications can include infection, bleeding, swelling, or detachment of the retina. Cataract surgery is a highly successful procedure, and improved vision is achieved in the majority of patients. Our aim at Dallas Eye Care is to provide our patients the most advanced procedures available today. Meeting your expectations is our most important measure of success.
Driving at night, the lights are white and they're bright and you can see them better. And big words, like at a distance, you can read them like street signs. You can read those, which I could never do before. So I've noticed a great improvement.
It's just a very nice experience. It's like opening up the world to you.
And I would tell anyone who needs to have it, not be afraid, do it.
And I understand they last for a lifetime. It's not something that will have to be replaced in 3 or 4 years. And that they will continue to improve some. So I'm looking forward to tomorrow.